So the first therapeutic strategy that we want to do for these types of symptoms is first astringe and dry the mucosa. And drain dampness. Okay, so we want to drain that dampness and we want to tighten and tonify that mucosal membrane. We want to astringe the laxity, is the way I like to think of it. What that does is it A, dries up the fluids, B, it tightens up that mucosal membrane so it's not as able to just profusely leak thin watery discharge. And of course, we want to select herbs that are not just astringent and drying to the mucosa or draining of dampness, but we want to select those that are going to have a specific affinity for the upper respiratory tract. Now, I'll note that, that's a relatively small select few herbs. There's lots of herbs that affect more lower respiratory tract, right? Throat, lungs, bronchioles, but sinuses and all up in here, not quite as many. Here's some of my favorites. We have Bayberry, Goldenseal. This is one area where I think Goldenseal is really nice as everybody thinks as a herbal antibiotic, mucous membrane tonic. Okay, that's the way to think of Goldenseal. Yerba Mansa, that would be Anemopsis californica. Collinsonia, also known as stone root, that would be Collinsonia canadensis. Sage, just your garden variety sage, Salvia officinalis. Eyebright, Euphrasia officinalis. Now everybody thinks Eyebright's for the eyes. Eyebright's really for the sinuses. It's not really so much an eye herb as it is a upper respiratory herb. But for Eyebright, you really have to use the fresh extract of it, a fresh tincture. And it's really hard to come by these days. Eyebright is becoming a difficult herb to acquire in the realm of herbal commerce. So good luck acquiring Eyebright, but if you can, try to find a fresh extract. And then red root or Ceanothus, many different species of Ceanothus that are pretty good. Americanus is the standard, but we've used a couple different varieties. And they all seem to be, at least the ones I've used, seem to be pretty interchangeable. Ceanothus velutinus, cuneatus, they all seem to be pretty similar to the Americanus. So these are all astringent herbs that will operate on the upper respiratory system. Really good ones there. Most are astringent, drying, and will aid in that excess mucus secretion.